I thank you. You can have a seat.
Thank you.
Good morning, Amy. My name is Miss Lambert.
Yes, my name is Amy.
I am one of the asthma control counselors at Hudson Clinic. And your name is Amy, right?
Yes, my name is Amy.
Nice to meet you, Amy. I would like to tell you a little about what I do here at the clinic. My job is to make sure you understand how to manage your asthma and the different asthma medication options you have and how they will meet your level of expectation. I'm going to ask you a few questions about how you control your asthma in the past. I'm not here to judge you, and everything you say will never leave this office. When your session is over, you will know how asthma medication works for you. Together, we will work out treatment plans that will work best for you and managing your asthma. Do you think you can do that with me?
Yes.
So Amy, why don't you tell me what brought you into my office today?
I am here because I have asthma. Ever since I could remember, my parents tried to control it, but they did a very bad job. They were smokers, which resulted into a trigger of my asthma. I am also overweight. I get short of breath easily. I don't exercise, and I'm afraid that my asthma is going to get worse. I was prescribed an inhaler from my family physician, but that still didn't prevent my asthma. I want to start by learning how to manage asthma, monitor my lung functions, and different types of medication that exist for asthma.
Okay, I can help you with that. Can you tell me a little about yourself, Amy?
I am in college, no longer with my parents. I have a single room, so I live by myself on campus.
Okay, I understand. Tell me what you used to manage your asthma in the past.
I used an emergency inhaler to control my asthma, prescribed by the family doctor, but it was not a preventative medication.
Okay, go on.
Even though I used the medication, my parents smoking in the home also caused my asthma to flare up frequently, although they were told smoking would trigger my asthma.
I can surely relate to what you're going through. I also had this situation while I was going to college and had to be counseled on how to monitor my asthma. It was tough dealing with it, but I got through it okay, and I know you can too. Please continue.
Okay, I have recently gone to a different doctor who has prescribed a new medication for a quick relief by the name of Advil, which is a long-term controller for asthma, but I have no idea of the different types of asthma medications that exist.
Oh, now I know your story. We can talk about an asthma control method that we'll use daily to help control your asthma.
All right, I'm excited to hear.
Amy, after reviewing your medical history, there's nothing we need to worry about. You are completely healthy, don't smoke, and do not drink alcohol. With that being said, you can use any of these methods on this chart. As shown on the chart, the options you have is to use daily inhaler to control your asthma. With the inhaler, you will need to use it every day at the same time for it to be most effective, preferably in the mornings. If the inhaler is used daily, it will help to minimize the risk of attacks by reducing the inflammation and irritation of the airways. I will also help you to prevent the symptoms. It will also help to prevent the symptoms from occurring by reducing the narrowing of the airways in the lungs. You can also decide to use anti-lucritins oral medication that help with constriction or swelling in the airways. Another option you have for long-term prevention is corticosteroid, which is a steroid that can be taken as a pill or inhaled. It helps to reduce inflammation and irritation and helps with moderate to severe asthma. Now that you know about a few options, you can use the one that will work best for you and the one you were most comfortable with. For example, if you do not like taking pills, or are not good at remembering to take medication at the exact time every day, then the option would not be best for you. That option would not be best for you.
Okay, thank you for the information.
One thing you should know also is the level of effectiveness of your choice. Much of the control of asthma depends on the effectiveness of patients' self-management of the disease. So you should take the medication as prescribed.
Okay, I understand.
Great. Be sure to schedule an appointment with your primary care provider to prescribe your asthma medication of your choice. If you have any problems, please let me know, and after you're finished with your primary care provider, make sure to make an appointment in 3 weeks from now to see me. I would like to follow up with you to make sure everything is working properly.
All right, I will do that. Thank you.
You're very welcome. Goodbye, Amy, and see you in 3 weeks.
Goodbye.